Indians are quite literally choking to death. And yet, this declining quality of the air we breathe is not the biggest headline, not the biggest electoral issue. What could possibly matter more? I'm Barkha Dutt, you're with the Mojo story. Images out of the national capital, of course, have gone viral now around the world. It has now become an annual ritual to see images like this. Just as the festival of Diwali arrives, and this year it's begun even before the festival, we see the onset of winter being accompanied with these are the images that you see on your screen. Most of us can't breathe. And this is not an exaggeration. Unless you're a person of privilege who can lock yourself up in a room and not go to work and sit surrounded by air purifiers from morning to night, think of those who have to go out into this smog, into this gas chamber and actually work. Delhi is the worst hit, but other cities too in India have grappled with air pollution this year, Mumbai being among the most prominent ones. But yet again, what happens year after year after year after year is a political mudslinging game between the center and the opposition, while citizens are left helpless, fatalistic, and almost left believing that nothing can be done to change this. Meanwhile, 1.66 million Indians died from air pollution in 2019. And can you imagine how much worse those figures would be in 2023? The Arvind Kejriwal government is locked into a political battle with the Modi government. But as I said, this isn't about Delhi. This is about every Indian citizen. How can the right to clean air not be the most important thing before us? Let's introduce our panel today as we look at the declining quality of the air we breathe and how it's quite literally choking us to death. A new study actually connects type 2 diabetes with air pollution as well. Let me welcome our guest to the program. Vinit Goenka is with us. Welcome, Vinit ji. Namaskar. Good to see you on the program. Abhinandita Mathur is with us. Always a pleasure, Abhinandita. Good to have you with us. We're also joined by senior pulmonologist, Dr. Gupta. This is a busy time for him, but I'm sure he's hoping or wishes that kabhi to there were fewer patients to actually see in the winters of our lives, quite literally. And also joining us is someone who's been a citizen activist, a founder of Warrior Moms, Bhavreen Kandhari. Bhavreen and I have been now talking for I don't even know how many years. Every winter we have the same conversation and nothing changes at all. Let me actually get Dr. Gupta first as a doctor's perspective. How bad is it this year? We are now seeing new medical studies that connect even diabetes, not just lung disease, but also diabetes, Dr. Gupta. Is this the worst you've ever seen? Is this the worst winter you've ever seen? It seems to have started much earlier this year. I speak as someone who's been impacted by this. I was hospitalized last year because of this air pollution, got pneumonia, and I know so many people must be worse off. What is your take, Dr. Gupta?
The pollution this time has been very severe. It's not actually only this time. Every year we go through the same time, same pattern, and for a few days there is so much of pollution that where visibility is reduced to almost zero. Especially in the evening hours around 7 p.m. or 8 p.m. when I leave for home, there's hardly anything visible. It's so much of haze, and if there is a dust blanket and smoke blanket. Of course, it's very catastrophic for health. It's very dangerous for health. There are a lot of persons that the new studies coming up that not only lung problem but diabetes and so many cardiac problems also can happen with the air pollution. So this air pollution, I am a chest specialist, so I will concentrate myself on this chest problems only. So I can see a sudden rise in patients coming to my OPD who were doing very fine till yesterday, but suddenly they come and say, sir, we have a new cough, we have a breathlessness. And all these things definitely can be attributed to air pollution. And I think we must do something about air pollution, at least if possible, then we should stop contributing to air pollution. But you can wear the mask and everything, but definitely we need to do something about air pollution.
But Dr. Gupta, we now know that multiple ailments are connected to this, from lung disease to type 2 diabetes to even heart disease. And there are people who are writing and saying they can't even sleep properly, and most people complain of headaches, allergic eyes, watering eyes. I want to bring in Abhinandita. Abhinandita, the Aam Aadmi Party now leads governments in both Delhi and Punjab. Earlier, the Delhi government used to say that stubble burning in Punjab was a key reason. What is stopping you, being at the helm of both states, from being able to do something about this, Abhinandita?
Thanks, Barkha. First of all, there is no, I can assure you that I will not do any politicking here and will very sincerely answer the queries of all our panelists. There are a few facts, however, that we must acknowledge. One is that this is not merely a Delhi problem. It is a regional problem. It is a North India problem. The other thing is that there are many factors that contribute to pollution. Unfortunately, at this time of the year, parali or farm fires are a major contributor. But at the same time, there is year-long efforts that are required by the governments in Delhi, in Punjab, in Haryana, in UP, everywhere, to actually curb pollution levels throughout the year. Number three, that the governments in Delhi and Punjab have always acknowledged the problem. We have never shied away from it. We have taken responsibility and we have been doing proactive efforts, both for seasonal impact as well as improving the long-term measures that we need to take as a country, in fact, not just in terms of whose government is where. Other last important point that I'd like to make is that this year there has been nearly a 50% reduction in farm fires in Punjab. This is not good enough. I say this myself and assure you that we will make more efforts. We will do everything in our capacity to reduce this in a big way by the time we are in the next cycle of harvestation. Number three, that whatever steps have been, taken by the Delhi government or the Punjab government, we have put that out. But it is very important to also ask the same questions to the governments of UP, to the governments of Haryana, who also contribute to pollution in Delhi and in the region during this time especially, and at other times of the year. And my final point would be that, while we are all, debating this and finding our solutions, where is the union environment minister? Why are we not looking at this environmental problem as a national crisis where the union has to take a lead, sit with all the stakeholders, all the chief ministers, whether it is Delhi or Punjab or Haryana, and also, not see that and not overlook the fact that the top 20 places that are most polluted are in fact in Haryana and two in Punjab. So there is obviously a narrative that we can build. And again, I'm saying that we take responsibility for our share of whatever we have to do. We will do it. We have been working on it. We did, Delhiites and the government together managed to have 200 days of good air quality this year, which is unusual. It's very unfortunate.
But Abhinandita, can I ask you, your party colleague Atishi, minister in the Delhi government, actually recently said that there were still no identifiable reasons that could, that where you could say conclusively this is what was causing the pollution. But a few years ago, when the Punjab government was not led by your party, the position used to be very different. At that time, the farm fire, the stubble burning was identified as the key reason. What's changed? I mean, we all remember from COVID when vehicles were off the road, the skies were blue. I'm not saying vehicular pollution is the only reason, but it's obviously a combination of construction, vehicles, stubble burning, dust particles, demolitions. It's all of it. And the proof is that we have lived through the lockdown years when we could breathe.
Oh, absolutely. I in fact, it's useful to look at the problem in this holistic way. I think what Atishi means to say is, and I agree with that as well, and that is that, there is actually not very comprehensive data on contributions to pollution in a sense that where we can accurately pinpoint what is happening. So I don't think that that is unscientific in any way. And of course, we are ourselves saying that, Punjab is a contributor and we are working on it. So there is no contradiction there. I think that the point that Atishi is making or Atishi made has metal as well. And, there is no doubt that there are many contributors and we still have to get to the bottom of it. But what is certain in this situation is, in terms of if we have to look forward and look for finding solution, it is that we have to work on everything. We have to stop the diesel buses. We have to improve public transport to reduce vehicular pollution. We have to have more wetlands. We have to have more green belts in this region. And all that stands valid in terms of looking in a positive way for a solution in the future.
So Abhinandita, let me bring in Vinit Goenka. The point is responses have to be broken into short-term and long-term, right? So wetlands and so on are long-term solutions. We need an immediate response. We can't breathe. It is just as simple as that. People cannot breathe. You cannot go out for a walk. Your schools have had to be shut down. There's also the smog tar in Delhi that has stayed locked. I'll come to that a little bit later in the program. Vinit Goenka, why isn't this a national emergency? Why isn't the center taking the lead on this? I think citizens are not interested in the AAP BJP ladai. We are simply wanting to be able to breathe.
Barkha ji, Ram Ram to you, Ram Ram to all the co-panelists who are there and the viewers who will be watching us. As a child, I used to read a horror story, the Hitler putting people in gas chamber. And I used to dream how would they be feeling. And today I feel like the same Jews who are there in the gas chamber sitting here in Delhi right now. Some figures should be known to you. Delhi government was very proactive under Kejriwal's leadership. They purchased biodecomposers for rupees 40,000. I repeat, for rupees 40,000, so that all the paralis in the Delhi region can be decomposed organically. And you will be happy to know that they have spent 15 crore 80 lakhs 36,000 rupees on advertisements. I repeat, 40,000 rupees spent on decomposers and 15.80 crore rupees spent on advertisement. They also spent the same year, 2020-21, 19 crore rupees on smoke towers, but spent more than 6 crore rupees on advertisement. This government is not serious. Arvind Kejriwal spends 15.80 crore rupees on advertisement of decomposers, which are just merely 40,000 rupees. He is not serious. He never sat with the CMs of the surrounding states. He never called on Haryana CM or the UP CM or the Rajasthan CM or Punjab CM. Tell me a single meeting which has happened between the CMs. He travels with the Punjab CM almost every day outside the jurisdiction of Delhi and Punjab, but they never discuss this particular part. Now let me come to you one more point. Total 54,000 lives gone only because of air pollution in 2020-21, leading to a loss of exchequer and also to the families, purely because the chief minister is absent, non-serious about this particular part. It's a state subject. And how did the central government help to improve this particular part? And could you ask me this question? Central government was very serious, and hence you see one of the congestion which was at Dhola, the roads and the highways there lie within the jurisdiction of Delhi government. They were not serious, but the Dhola Kuan junction was changed. There was a subway being made and the ease was done, and now we see that the junction has been improved. And if you see the geospatial photographs, satellite imagery of that particular area, the pollutants have gone away from there. 2, Eastern Periphery Road, which was built by the central government, eases the traffic in the Delhi, because the traffic which are not meant for Delhi don't enter here. Number 3, the rapid rail system which is there for metro, for Merit, has also improved the traffic which is there in the eastern side of this. But what has Arvind Kejriwal did? He stopped the metro phase 4. We were requesting him, please allow the metro phase 4 so that...
Vinitji, there are many tough questions that should be asked of the Aam Aadmi government, but I ask you as an Indian citizen, the national capital is also the seat of power for the central government. Our judges, our cabinet, our prime minister, our president, everybody lives in this capital. And again, Delhi is not the only city that is racked by pollution. There are places in Haryana, there are places in Punjab, there is Mumbai that has recently been battling acute air pollution. Why won't this be declared a national emergency? Because it is a national emergency. Let the Modi government take the lead. Let the Modi government show how it should be changed. And if you think Kejriwal's government is doing such a bad job, show them how it's to be done. But why is the central government washing its hands of this, Vinitji?
I think you'll have to stand corrected. This has been discussed at various levels. There has been request by the UD, the Urban Development Ministry itself. Mr. Puri also requested. There is a letter which has been shot to the Chief Minister. He chose not to reply. Courts have, summoned Kejriwalji. They have, in fact, even observed that he has money to spend on advertisements, but he's not serious about NGT or other things. Let me also bring your attention to one particular part. This farce of, odd even. When you force people to go through the odd even of the vehicles, do you think people don't travel in taxi? Then, the taxis from the nearby area, Gurgaon, Noida, they enter Delhi. So the number of vehicles don't come down, but it's a farce. It's a pain to the citizens. The farce of having smoke towers, and they are non-functional. So we'll have to investigate why did they spend that 19 crore rupees? Did they take action on that particular part? Number three, people like you and me, we are conscious citizens. We would like to travel in DTC buses, but you would be pained to know that the number of buses after Arvind Kejriwal became CM has come down to one third. The number of buses which are operational right now in Delhi are one third what it was operating in 2013. Now, how do we have?
Yeah.
But the central government has given more than 100 buses with their electrical buses to them. Central government has also built that subway which is in the Pragati Maidan, which eases the traffic there particular part. But if the chief minister is a visiting chief minister who chooses to spend 6 days outside Delhi, does not sign up, is busy, spending money on the lawyers. The amount of money which he has paid to the lawyers in the last 4 years is enormous. If the same money is
Okay.
used in solutions for pollution, I'm sure we will have some relief.
I think you've raised some very important questions, and I'll take them to Abhinandita in just a moment. But let me bring in Bhavreen Kandhari. Bhavreen, I have lost count of the number of shows you and I have done together. It's been years. We keep discussing the same thing. I have personally reached a point where, having been hospitalized for pneumonia, I do not go out for a walk anymore. But I am a person of privilege. I can afford to talk like this. Think of people who have no choices, who have to go out and drive a cycle rickshaw, who have to go out and work on a construction site, who are daily laborers, daily wages, who cannot afford air purifiers. It is shocking that this does not enrage us. It is shocking that this is not the most important thing in India today. Bhavreen.
Absolutely, Barkha, and thank you so much for always talking about it. And you were even speaking about COVID, and you've had a personal loss as well. Like most of us, if you remember that everyone has lost a near and dear person, and that is primarily because of the weak lungs. And why we had weak lungs, because we are living in a city which has given us this, over the years. Every third child in the city, I've said this so many times, with the asthma study from 2019 done by Lung Care Foundation and Dr. Arvind Kumar, it clearly points out that every third child has damaged lungs or an asthma or a COPD or any lung-related problems. This is just heartbreaking. And, to see politicians play this game yet again and again and again of, blaming each other. I just feel that as a parent, as a citizen, it doesn't matter to me who is doing what or not. I will tell you I will go back actually in the last 3-4 years and just point out to various things, whether if one was, maybe, we just heard that they probably put a smog tower. At that point of time, they were trying to take credits. Who built it, who wanted it, while people like us with experts were writing from day one that this is not going to work, you're wasting money and time, but it was not being heard. The biggest construction project started in Delhi was during COVID. That wasn't necessary. Even today, it has so much dust coming up. Why are we not holding on to the huge government projects in the city? Before that, it was the 7 GPRA. Even before that was the East Kidwai Nagar. So we have to understand that, once we solve the problem and come to an AQI 60, then we do everything. You can, come burn your crackers that day, or you can, even do construction. But until then, like you said, it's not even an national emergency. It's a public health emergency.
Are you at all hopeful of anything changing?
Well, at this point, then every year you think that, yes, maybe, because, in the initial days when we are saying that the fires were lesser, of course, we were watching that. We knew that the harvesting time is a bit postponed, so we will see worse coming in. But, every source, Barkha, this is all about systemic changes. This is all about policy. This is all about institutional changes. Yes, you're right. It will take time. And we need to be patient, and they must work on it. That is the last thing. While you say one thing, but you're doing another. The Aam Aadmi Party may be saying something. They're cutting 5 trees an hour in the city. The metro is saying delayed. They cut 14,000 trees in the phase 4. Why are we doing these kind of, decisions, taking these decisions and actions? that will cause further damage. The policy, we have a car-centric approach, like we just heard, from my co-panelist, and we must have a good, robust public transport system. What are we waiting for? We cannot wait 2 years,
I don't
and
know
3 years,
what.
and 4 years.
Yeah, I don't know what we're waiting for. People don't seem to care that their lifespans are actually being shortened. But I want to just ask before I go back to the Aam Aadmi Party leader with the questions that have been raised in the program, Dr. Gupta. Some studies suggest that the air we're breathing is equivalent to smoking 30 cigarettes a day. So, what is the purpose of creating awareness against smoking and so on? Because look at what we're inhaling. What is the, I mean, talk a little bit about that. That this is as good as being a smoker.
But you are very right. Air pollution is so much that is almost even non-smokers, they have become smokers. But at the same time, if we don't ask the patient to quit, don't encourage the patients to quit smoking, that we are encouraging them that, okay, this is something you can't do, but this is something you can do. So you stop smoking. At least you will don't do much harm.
No, but
Increased
I'm
harm
saying
to
also
yourself.
don't
But at
smoke.
the same
I'm saying Dr. Gupta,
time, even
jo cigarette
non-smokers,
nahi peeta. Yeah, exactly.
the same
Cigarette.
time non-smokers, they're forced to
Yes,
smoke. And
yeah,
everybody knows that
exactly.
smoking is so much injurious to health. It can lead from COPD to bronchitis to even cancers and even gastritis and so many things.
Yes.
So definitely, as
Abs
our respected panelists have said, that there are so many of efforts are going on, but then putting on the blame on this one, that one, we are doing this thing, we are not doing this thing, or it should be done, or that should be done. I think it's more of a people's participation until unless people are educated and made aware about it. And they should
yeah.
do the things that to educate the people. And at the same time, the problem about farm fires. Now the window is very short, which I feel that window about the the harvesting of the previous crop and the next crop, the window is very
Yes.
short. They should find some ways to use that stubble. In many areas,
Yes.
stubble is being used, but they should find some way. And they say that there should be decomposters. But again, decomposter will take some time to compost to turn the residue into
Yes.
compost. There should be some ways to encourage the farmer. There should be some ways to utilize the stubble. And definitely, if we look at the farmer's point of view, they have no other option. I think they have the options, but they are afraid of using those options. I think government should come here, and every government, whether it's BJP, it's Congress, it's AAP, anybody, even local communities, they should come forward and help those farmers and also participate in the reducing the air pollution in their own ways.
So let me take some of these specific questions to Abhinandita. One is a 23 crore smoke tower that is found to be ineffective. Bhavreen says that activists had warned that ye nahi chalega, but the government went ahead with it. Gopal Rai of your party colleague has actually said that take action against the chairman who closed the smoke towers, but experts say the smoke tower isn't going to be effective. The 23 crores was spent on it. The Supreme Court in 2021 has said that we're going to audit your advertisements. Vinit Goenka made a reference to those. Do you believe, Abhinandita, that the Aam Aadmi Party has failed, as Vinit Goenka alleges, to take air pollution seriously because he calls Kejriwal a visiting chief minister too busy in elections and fighting legal battles? How do you respond to that charge, Abhinandita Mathur?
Honestly, much as the pollution hurts any kind of politicking of this nature also hurts, because we have to find solutions. We have to accept our share of the responsibility, which I don't see from either the BJP spokesperson or their party in general. About the smoke tower or other efforts that are being made, there should be no problem in even experimenting or wanting to make efforts, and then they're all towards a constructive solution. Number two, about the farm fires and the solutions of for farmers, I think that is a very important point that Dr. Gupta raised, that of course it has to be you have to give incentives to the farmers. You have to find a solution for them, which is what, for example, we are trying to do in Punjab with 4,500 volunteers on the ground who educate and make aware the farmers. Of course, there's a long way to go. I'm not denying it. In contrast, if you look at the Haryana government, what the Haryana government is doing at the moment is going and arresting, filing FIRs against the farmers. That is no way to find a solution. Coming back to the point of what all has been done and whether advertisements or absent chief minister, it's too rich coming from BJP, because less said the better about their leadership. Whether it is a crisis in Manipur, whether it is a crisis of COVID, their leadership has been absent for a very for long durations, and just have the audacity to actually to make political arguments out of actually a climate and an environmental.
What do you need? What do you need, Abhinandita, from the central government at this point? You said the Modi government should take the initiative. What do you need from them? What do you want them to do?
Well, we want them to first acknowledge this as a national crisis. Number two, we want them to take ownership of the region, that understand that this is not a Delhi state problem or one state problem, to take ownership and accept the fact that this is a regional crisis. Number three, of course, get all the stakeholders involved, make sure that the other states are also doing their bit, and of course take us to task, take the Delhi government to task, same with the Haryana government or the Punjab government or the UP government. So all this is essential. Where is the leadership? Where is the acknowledgement of the fact that this is a regional or a national crisis? There isn't anything. And it is unfortunate that a ruling party comes on TV to say that, okay, Kejriwal ne ye galat kiya. These are the same people who, whenever Delhi government tries to do something, come in the way of our work. So I don't think that this argument will be accepted today. I think that's in poor taste,
Okay.
especially at the time.
Let's take this to Vinit ji. Vinit ji, there are
Sorry, I'll just finish very quickly. We have Delhi is leading in terms of the EV policy. There is a fleet of 800 buses that are electric on the ground. There is everything in our capacity, in our imagination, that we are trying to do to make those long-term, make that long-term impact. We are saying we're open to suggestions. We are saying we are not perfect, but we are taking steps, and and they're also out there. What has the BJP done is my question, in their respective states to curb pollution?
So let me bring in Vinit Goenka. Vinit Goenka, there are states battling air pollution on the margins of the national capital. Haryana, UP are two examples that have been given, right? So, and as I mentioned, there's also been Mumbai that has battled very, very severe air pollution. Hence, this needs a national response. Would you agree with that? That just like in COVID, you had Modi government steering and coordinating different states, we need a national emergency response. How do you respond to this, Vinit ji?
Good. I like the consistent behavior of Aam Aadmi Party leadership. That is Arvind Kejriwal ji and the spokesperson who is there on your show right now. They're very consistent. One, Arvind Kejriwal ji comes on televisions and advertisements and promises that next year will be a pollution-free thing. Two, they are consistent in pushing their efforts to the central government. The moment you ask them a question, they said central government. So I would like to ask the spokesperson of Aam Aadmi Party, did you write a single letter in the last 8 years? Did you respond to the letters written by UD to you that please come and do the meeting? I have written letters. Did you respond to my letter? So I have written letters to Honorable Kejriwal ji that let's meet. We have some solutions. I thought I'll bring people from geospatial space. If Abhinandita ji is not aware, I work in the space of geospatial. We could actually help him. He chose not to reply my 6 letters which are there. So I'm not talking about anybody else. My personal request, which was not honored, that he would like to meet. But yes, students will miss these classes. Employees will miss their jobs. Sportsperson can't go to the field just because Mr. Kejriwal will buy a decomposer for 40,000 rupees and spend 15.80 crore rupees on advertisements and 28 crore rupees on lawyers. Now, Barkha, please explain this to the people who are watching you right now. Does it make any sense to buy a decomposer for 40,000 rupees and spending 15.8 crore rupees on advertisements and 28 crore rupees on lawyers? Now, this is no rational. So there is a huge corruption. He has time and every efforts to renovate his house for 45 crore rupees. He has time to sit in the COVID period, make a policy of liquor.
Okay.
Where, there is corruption.
I think the Kejriwal government.
Last two lines.
Okay. Okay.
Today, I have a heartbreak. I have a lung burn because of pollution, but I have a heartbreak because the chief minister is absent. He is not addressing my problem. My head is actually shambles because we would live in NCT capital, which is not been addressed by them. And this is not about air pollution. Let's see about Yamuna. We have 29 videos of Mr. Kejriwal. Agli baar ghumane leke jaunga. Bhai kabhi to leke jaiye. Kabhi nahi leke jayenge. Non-serious politician. Blame it on central government.
before Abhinandita responds,
भारत
because
को
we have
ये
to start.
बेचेंगे लेकिन
We have to
पॉल्यूशन
start.
की solution नहीं देंगे.
G. Bhavreen, one thing you'd like to see urgently change in policy? Immediately, not long term.
Vehicular and construction, these are the two things that will be very quick, and it can be done, because even right now, yesterday I was counting, 23 cars crossed me in 1 minute. That are only single driven cars. Does that happen in any major metro in the world anymore? No. The parkings, this is not ad hoc measures to do it now, this is forever. But these are all vote banks, so they're so worried and scared. This has been said over and over again. Even at the Supreme Court, CAQM was formed, and we were part of the petition. So we gave all these suggestions. Everything has been said, and it's nothing. They have the top bureaucrats, the top brains everywhere in the union and the state governments, and they know everything and more. But it's not working out. There is nothing being done for the sake. There are congestion taxes. There are emission charges when you go to places where they're working on pollution. But in our city, in our country, there's nothing like that. I mean, you can have 10 cars and you can drive to pick up a coffee.
Yeah.
And you can construct.
And I think that goes to citizens' response also, Dr. Gupta, which is the point you were making, that we have to change too. We have to be willing to
but government has to lead. Sorry, it's not the onus on citizens.
Of course.
Citizens will be led into this with policy. You cannot tell people will not give up cars. You'll have to snatch it out of them. And why Singapore? Everybody's scared to have a second car. That's the way it is.
No, I'm just saying that when that happens, we have to not complain. We have to accept that policy. Dr. Gupta, one thing.
It will be a law.
Yeah, exactly. But koi kare to, koi wo law pass to kare. Dr. Gupta, one thing you'd like to see change in policy?
Definitely, there should be some change in policy. Like, I commute to hospital every day, but if I talk about this mass transport system, let's take a metro system. The nearest metro point is about 2.5 kilometers from my house. So there is no end-to-end point connectivity. So I am forced to take a car. It will take about 45 minutes for a journey of 15 minutes by car. So I'm forced to.
Yeah, that's a good point. We lost Dr. Gupta there, but I think he made a good point that most people, there you are, that most people, the metro stations are somewhat far from the endpoint of destinations. I want Abhinandita to respond, and then I'll give Vinit ji the last word. Abhinandita, go ahead. Abhinandita, please unmute yourself. Hang on, please.
I'm actually slightly outraged by the discussion and especially the comments of the BJP. It's very, very unfortunate. It's very disheartening to hear this kind of discourse. My only request would be that, shine by example and tell us what are the steps that have been taken by the UP and the Haryana government over the years to curb pollution, number one. The other aspect is that, it's very easy to keep belittling Mr. Kejriwal and, try as you can. But the fact is that when there are people who are suffering, when their lungs are choking, at least we have the decency to come out and say, okay, this is our part of the responsibility. Where does BJP stand? What they are doing as a response is actually just, dismissing us, belittling us. That is very, very unfortunate. And I'm sure that every citizen right now is angered by the response of the BJP, and they're very, very cheap, lowly politicking at this point. The last point that I want to make, and I really agree with our expert here, is that vehicular and construction, these two things that must be controlled immediately, and we are on it. And Delhi has actually been one of the few states, or perhaps the only state, that follows the GRAP sooner than the emergency. Again, I'm saying in the same breath that we have a lot more to be do. But we must, in perhaps a later conversation, speak about GRAP and the steps that already have been taken. That is it. But I will repeat that before we end, we would really like to hear from the BJP spokesperson. What is it that Haryana has done in the long term or short term? What is it that UP has done in the long term or short term? So that we can see that you have some locus to question a government that is at least taking its share of the responsibility.
Okay, let me give Vinit Goenka the last word, and then we do have to close. The point is that states have to coordinate with each other, and India cannot afford political bickering over this issue, right? How do we move forward? How do we move forward from this point?
No, good. Abhinandita ji brought this point. I'll repeat my request to her that I have written 6 letters myself. If you can answer them, and we can have a meeting. So at least I can have a meeting and I can suggest what I have in my
और आप
mind.
क्या
And
बोल रहे हो? आपसे क्या पूछ रहे हैं और आप क्या बोल रहे हैं? आप अपने 6 लेटर की बात कर रहे हैं या बच्चों को सांस लेना है? आप बताइए ना, यूपी हरियाणा में आप लोगों ने कितना एग्जेम्पलरी काम किया है, बताइए स्टेप्स क्या लिए हैं सेंटर ने और आपकी स्टेट्स में. आपके 6 लेटर की बात नहीं हो रही है. आप बहुत
Okay, let him respond. Let him respond now, Abhinandita. Yes, Vinit ji, please.
Because my upbringing does not permit me to speak in between. So let me complete my point.
Okay.
So, destiny of Delhi is death and disease. Just because the visiting CM spends 40,000 rupees on the solution, but spends 15.8 crore rupees on advertisements, 28 crore rupees on lawyers' fees. He has to be serious. He has to respond to the letters of the people who would like to provide him.
How are we going to have a coordinated approach to this
He
issue?
should be there in Delhi and meet people. He should answer to Dr. Puri's letter. He should answer to the central government's request of meeting. He is not there, Barkha. Call him on your stage. I will make sure that somebody serious from the party is there with you. He is not ready to address that particular part. Tell me this, will people not ask him, why did you spend 15.80 crore rupees on advertisement?
I am saying, please ask all the questions that you want to, all the tough questions. The Kejriwal government
he is not responding.
But I am only wanting.
Not a single letter been answered. My MLAs are asking him questions. He is not answering to them. He is not available.
Okay, I will have to leave it there. The BJP and the Aam Aadmi Party disagreements notwithstanding, Bhavreen and Dr. Gupta come from the perspective of what citizens are going through. I don't understand why we as people cannot put more pressure on our political parties to respond. If electoral decisions are going to determine this, then let us vote on issues such as this, because nothing can matter more than the quality of the air we breathe. I'll have to leave it there. Thank you to Vinit, Goenka, Abhinandita Mathur, Bhavreen and Dr. Gupta. We will continue on the ground to follow what the air is doing to our lungs, to our health, and to our literally mental well-being. Thank you for watching. Take care. Mojo's Story has always made a commitment to its viewers to go to where the story is. And as you can see here, we are at the epicenter of the Israel war on Gaza. We are right at the front line, about 1 mile from the Gaza Strip, as the Israeli military gets ready with its tanks and its gunners to begin its final frontal assault that will take troops into Gaza. As we said, we are not like other organizations. We believe in giving you all sides of the story objectively and as much as possible from the ground. And that's exactly what we're doing here, covering the biggest global story today from the epicenter of the war zone. So please, we need your support. Support us, become a Mojo member, subscribe to us, spread the word, and thank you for your support.